Today we will be talking about the relation between physical therapy and occupational therapy. So after the accident, we start the rehabilitation process from the beginning to manage the pain, manage the swelling, and restore the range of motion. Slowly we progress as the patient has an options to the functional training and more strength back to the normal life. So physical therapy interference is required by basically any issue with the musculoskeletal system, such as joint pain, muscle pain, chronic pain, status post surgeries, or the sports injuries. There are specific fields in the physical therapy which are, for example, specialized in the women's health, fertility problems, or the children's physical therapy. So what can the individual expect is that first, when you come to the physical therapy session, the therapist does his own assessment and history. Then we go to physical assessment, and then we proceed with the treatment. Now the problems are very individualized and every patient is treated differently. I can, for example, have 3 women of the 40 years of age, all medically healthy, and each of them will come with the right shoulder pain. But one of them might be treated for the frozen shoulder diagnosis, one of them might be treated for the sports injury and specific muscle rupture or strain, and the other one could be treated for example, reflux issues and the chronic pain referred to her shoulder. So we always have to look at the whole body of the patient and assess the area and determine what's the primary problem and where we want to start to treat. The area of the pain is not always the area of the issue. The process of physical therapy can take anything from 1 single session up to 30, 40 sessions. It always is individual and it depends on the diagnosis, age, and all the conditions that the patient has. Physical therapy and occupational therapy relation is very close. We always work in a team, in the integrated team, to treat the patient and to bring him back to independence. I would say that the physical therapy is a little bit more analytical, and we are focusing on the specific joints, muscles, range of motions, and we do the functional training as well. On the other hand, the occupational therapy focuses on the ADLs, like activities of daily living, and more practical skills of the patient for his everyday life.
Occupational therapy is a healthcare profession that provides practice support, empowering patients to facilitate recovery and overcome barriers preventing them from doing the activity that matter to them. This support increases people's independence and satisfaction in all aspects of life.
Occupational therapists help people of all ages overcome the effect of disability caused by illness, aging, or accident, so that they can carry out everyday things for occupations.
Therapies consider all of the patient needs, including physical, psychological, social, environmental, and identify appropriate treatment goals.
We are honored to welcome Suzanne Whitehead, occupational therapist. How are you?
Hello, thank you for having me.
Pleasure to have you here.
That was a long introduction, huh?
Exactly.
Yes, it is.
So
you deserve it.
Yeah, thank you for being with us tonight. So could you tell us about the occupational therapy, what it is and who needs it?
Wow, that's a big topic. As you've already explained, occupational therapy primarily focuses on helping people become more independent and helping people do the things they both need to do and want to do. Okay. So occupational therapists can be seen in a wide variety of areas. If we talk about the medical component, you would expect to see an occupational therapist on a stroke ward, for example. Okay. Strong evidence and guidelines suggest that patients, as long as they're stable, should be seen as soon as 24 hours after their initial stroke.
Wow.
And that's an OT, occupational
yeah,
therapist
yeah.
job.
Okay, yeah.
So facilitating rehab on an inpatient ward, and then being able to prepare that patient and the family for discharge back to their home. You would be expecting to see an occupational therapist working in outpatient clinics, working with hand rehabilitation, for example, post-surgery. We would be expecting myself to be on surgical wards, especially for people undergoing operations who require support to get back on their feet and get back to independence. I told you there was a lot of things.
Yeah, it's very important.
Yeah, and you would expect to also see us not just within the medical or physical field, but supporting people with mental health needs. So inpatient hospital mental health wards, providing graded activities to help people recover from mental illness, and then where feasible, out in the community doing that too, in helping people get back to work, return back to a normal life, and then not forgetting the children, working with kids, again in hospital, in paediatric units and inpatient services, in private or clinics, in the clinic-based outpatient settings, and in schools also.
So it's not only the occupation therapy for the hands and for the legs. No, it's more than this.
There's a misconception, I would say, even within the medical profession, that occupational therapists help people with their arms and their hands, which it's an element. And one of the reasons I see, and through my experience, that people see this is because think about your daily life when we talk about function. So many things you need your hands to do. Whether it's a daily task of brushing your teeth,
tie shoes for the kids,
feeding yourself. For kids, playing is their occupation. So I think that's why a lot of people see occupational therapy as working with hands and upper limbs, because it is predominant. But occupational therapists, through their training, also work to understand a person's needs in terms of equipment, adaptations. So you see equipment in people's houses, paediatric wheelchairs and equipment. That's an OT mostly who's doing that. Also working with the brain and the mind in cognitive function, which is a
coordination.
It's a little unique. Physiotherapists often it's they're interchangeable. But occupational therapists are trained and equipped to assess cognitive function, memory deficits.
Like people with dementia? Or
exactly. So looking at, identification and support in identification of dementia, Alzheimer's. Any progressive or degenerative disease that may see, say, cognitive function decline. That also applies to children, children with learning disabilities, understanding what their needs are based on individual assessment, and then being able to help that adult or child achieve their maximum potential.
So they work with all ages?
Yeah, I mean, starting with children, usually as children start to interact with their environment, that should be around the time that the parents or nursery workers start to notice that the child maybe isn't interacting with their peers or engaging with their environment the same. And then up until end of life, and occupational therapy has a big role to play in helping people, I would say, die with dignity, helping people and families adjust to someone who isn't going to get better, and providing the necessary equipment, aids and adaptations, allowing that person to become, have the best quality of life for as long as possible.
Like to be independent more.
Yeah, and even if they can't be independent, to make them as comfortable as possible, and to also allow the family to ensure they're doing the most they can for said individual.
I'm really excited about what you're talking about, and I would like to know, what are the outcomes? Do you have any outcomes here in Kuwait, that people that you helped here?
So some real life examples, right? So I've been in Kuwait 6 years now, and I've seen a variety of cases. I work mainly with adults, with those either elderly or those with a neurological deficit. So neurological deficit that I can think, someone that springs to my mind was a younger lady. She was in her 40s. She had a stroke, unfortunately. She had two daughters in their 20s that, of course, were very anxious about their mum.
It's a big problem.
It is, especially at such a young
she's
age.
Young.
Yes.
She's
Exactly.
young.
And she was seen by myself in her home environment, of course, because occupational therapy is needs to look at the person as a whole, and so seeing people within their home environment is really important. It's important to know how a person engages with the home environment, what's important to them, what their routine is like. So this lady I saw at home, and she had quite a significant deficit, both physically. She wasn't aware of her arm, for example. She had impaired speech. She couldn't express herself through speech. She couldn't move her arm.
Did you help her with that?
No, I left her alone. Yeah, of course I helped her with that. And she also had a cognitive deficit. So you ask her to complete a motor task, she couldn't follow commands. And through that initial individualised assessment and graded goal setting with home exercise programs, I worked with that lady for nearly 2 years, to the point where my last sessions were getting into a car with her, enabling her to drive.
Oh, that's great.
That's very awesome.
Yeah.
Good.
So through
Good achievement.
Yeah, and that was I would say a long journey, but that's pretty average for someone recovering from a neurological disorder. You know, she was really interested in things like being in the kitchen and preparing meals for her family. And as an occupational therapist, you know, that meaningfulness in her life is part of her rehab. So we were in the kitchen, we were doing balance techniques, we were using cutlery to chop vegetables.
Very good.
So you trained her, like
so part of it is retraining. But from an occupational therapy perspective, the more meaningful it is, the more engaged someone is and motivated.
It definitely make you happy as well as their
So
family.
we have good fun. We have good fun in our sessions.
That's
Keep
amazing.
the hard working, Susan. We have more. We have to talk about it, but we have a short break.
No problem.
So, dear viewers, we have a short break, and we will be back. Please stay tuned.
Back again, dear viewers, with our talk and with Susan Whitehead and about the occupational therapy. So please, can you tell us more about the team and the multidisciplinary team? Is that really important?
It's very important. So for those watching who don't know what a multidisciplinary team is, basically it means more than one discipline working together. Within any healthcare field, one person can't do everything. It's impossible because we all have different clinical specialties. So there are a group of individuals, depending on the environment and the location of the therapist, that are really essential to work together. So for example, in a pediatric clinic, you should expect to see an occupational therapist, a physiotherapist, a speech therapist, behaviour therapy or counselling services. You would hope, obviously, depending on the location, to see a paediatrician or medical doctor, pharmacist.
Wow, it's a big team.
Yeah, of course. And because a person is complicated, right? It's not just there's a physical issue, let's solve it with said person.
There's a lot of aspects.
Yeah, and that applies to outpatient settings, inpatient settings. As I already mentioned before, people often get physical therapy and occupational therapy a little interchanged or mixed up. It's the same thing. And that's not a bad thing, right? It means that we can work really closely together.
To solve a problem.
Yeah, and a lot of places, the therapists will do sessions together. They will be integrated into the same session because their goals are so similar. And what they want to achieve with the patient are so similar. So working in our own, what we call individual silos, individual boxes, is not effective treatment. And any professional, in my opinion, who thinks that's the right way to go and thinks that they can do it all,
No.
it's not the best. lots of research and all the guidance states the real importance of a team that integrates all those different specialties and all that training and knowledge together in order to achieve the best for that patient.
Susan, how the patient, when they have to seek the OT, when they know how to seek it?
Yeah, and that's a really good question. There's a couple of things in there. One is, for example, anywhere through the span of life where there has been a significant change. So, for example, someone has a specific injury or a life-changing event that results in that person, for whatever reason, whether it's psychologically, mentally, physically, they can't return to their normal life. Something is preventing them from getting back to a level of normality or a level of function. And then, of course, on the opposite scale, talking about the pediatric population with kids, they don't undergo a life-changing event. But often parents will notice, like I mentioned before, something's just not quite right.
Correct.
And parents should act on this hunch, this feeling. And if somebody else points it out, like, you know, not to just dismiss it and go, what do they know? You know, but they can't talk about my child like that. You know? So first port of call for anything like that is always to go and see a doctor.
Sure.
You know, because it's really important to rule out anything medical. Anything medical going on. That's the first port of call. And then the relevant advice based on any diagnostics can then happen. Similar with adults. Sometimes there may be an adult who, for some reason, they're seeming a bit confused. Maybe they're a bit disorientated, or there's a change in their behaviour. It's important not to say, oh, well, they're getting old. It's normal.
Oh, no. They don't have to ignore it.
And there's from my observations here in Kuwait, unfortunately, there's a little lack of preventative care. So recognising such things early, this could be the early signs of dementia. It could be the early signs of a stroke. It could be the early signs of a neurological disease such as Parkinson's. So
early intervention is very important.
Even if it's something mild, there's no harm. There's no harm in going and checking the symptoms. So a couple of points. One is when there's a life-changing event that is preventing someone from returning to their normal function. And then the other where there's a hunch, there's a feeling, there's something not right. Often people will go then to a doctor. And then the doctor will do their relevant investigations. If there is something specific, then's your time to see an occupational therapist to plan. To plan going forward.
So Susan, if anyone wants to be an occupational therapist, what is your advice to them?
Oh, go ahead.
Do it.
Do it. So if we have any youngsters watching, work hard at school, of course, because this is a science-based profession. So there are entry requirements in order to enter the degree program. So that's important, of course. As an adult, who says we have to do the same thing forever? There are options to study, do masters and top up your degree depending on what it is to become an occupational therapist. But before all that, do some research. The World Federation of Occupational Therapy, the British Association of Occupational Therapy has some good info about what you should know. Think about why you want to do it.
And you have to be passionate about it.
Because
humans.
So you have to sort of like people.
It helps because you are interacting with people and the close interaction.
And I think that's a really good point. You have to be really comfortable and understand what that involves.
Social person.
But also
just like you.
But also you have to understand that you don't just go and get your degree and then that's it, right? It's part of an ongoing learning process. Anything in the medical field is constantly new research, new advice, new developments, and so it's not to scare people off, but it's sort of a commitment in the longer term too. You want to grow as a professional.
You should have the passion.
Yeah, you should. I mean, occupational therapy isn't so known, so most people that know about it have it's touched them somehow. You know, it's either a personal experience or something's happened in their life to come across an occupational therapist. So do some research. It's a really rewarding profession. If you're very social, you're practical, and you love problem solving, occupational therapy is quite a practical profession. So if you have those certain skill sets, then you're good at analysing things, trying to solve problems, want to work things out, try new things, be creative. It's a really lovely profession.
And I think we need it here in Kuwait. Like Kuwait, you must really do these things, like the occupational therapist.
Yeah, I mean, I think that it's a lesser known profession, which is a shame because it can add great value to life, both for family members and the individual. I think it's up and coming. It's been around for a long while and was actually developed on a hospital ward where people were sat around bored. And there was a group of people who started to give people activities and things to do. And then the profession sort of grew from there. So it's really important. It can hold real value. It's unique.
So it's not well known only in Kuwait or in the whole world. So
it's more well known in the Western world, as one would say. It's a little more established. It's a science-based program, so theoretically it should be just as popular. But I think a lot of people focus on the physical being, which is why physical therapy tends to get more of the spotlight.
More attention.
And the lesser known elements, the cognitive function and all those psychological aspects aren't as well known. So I would advise people, even if you don't want to be an OT, go and research about it.
Exactly.
You know, go and learn about it. See how it may benefit somebody in your life.
Thank you so much, Susan.
Thank you.
It's amazing information.
Thank you.
So, dear viewers, we will go on a short break and continue after. Stay tuned.